When it comes to hospital-acquired infections, we have to manage that risk, and lead aprons are a unique piece of equipment in the hospital because they go throughout the house.
If I have a surgery where I'm going to need lead, I will go to the hallway where there's the rack and just grab a lead apron and put it on, and so will the other staff in the room. Then you wear it during the case, and then when the surgery is done, you go hang it back up on the rack.
They can come into contact with patients. Certainly there's sometimes open wounds.
We are exposed to bodily fluids, so that's either blood, sputum, can be stool, also sweat. Prior to finding RCS, we had just a wipe down theory that we thought we were doing okay with, but when you actually went and tested it, you could see that it really wasn't clean at all. You could see things on lead and we could never get them off, so you know it's a spot, but you don't know what that spot is. That's just gross.
One of the primary things that I worry about in my role, working primarily in the operating room and then endoscopy, is surgical site wound infections, or SSIs. We get measured against that, as does every other hospital, but it's just been a long-held belief that if a patient comes back for an I&D procedure, irrigation and debridement, that means that they have an infection, and that's our fault. Everything that we can do to prevent that from happening, we should do.
With a disinfectant wipe or even solution, just that motion of friction, that would take off the surface, but it really would not get to the matrix of that biofilm. I would suspect if they're not professionally cleaned that you would have biofilm.
We have a protocol for cleaning the floor, the ceiling, the walls, every piece of equipment, and yet the lead vests, we had no process in place.
We wanted somebody that we could find to essentially deep clean our lead, and that's what RCS has been able to provide for us.
After using the processes that RCS uses and they test, you're pretty confident that they got all the organic matter off of the surface of that lead apron.
Not only does RCS clean it, but they also make it look nice and pretty and fix little holes or stitching, things like that. So I think my responsibility is to make sure that it's presentable equipment, it's clean for the patients as well as the employees wearing it.
RCS, I think, provides a very unique service. What we've seen firsthand on our aprons here, it really does show the need for it. And they provide just one more means by which to break that infection cycle and hopefully reduce or ultimately eliminate our infections.
The staff members who do particularly orthopedics or spine procedures where they have to wear apron all day long, they are very choosy about which piece of lead they're going to put on, because that one smells, or I think that one's dirty, or that thyroid collar is disgusting. And we should never be in a position where our staff have to use those phrases about what's really personal protective equipment that we're providing them. They should feel good and confident about what they have to put on. And I can tell you now that they do.